If you miss out a few questions here, you're going to be out of your competition. I'll give you example how. Moderately difficult. They are not easy, they are not difficult, they are in between that. Okay, moderately difficult. And these are 30 to 50 questions which are known as dark spots. Okay, this is where your rank is going to get decided if you want to get into a government college or a reputed college or not. The significance of these questions is it decides your rank between 1 to 350. Now this is why you people are here, isn't it? Now this is where your concepts has to be very, very, very clear. Okay, this type of questions you don't get it from notes or by simply solving some random MCQs. Notes can't teach you concepts. Many students ask me, do you give notes? That's the first question people ask. I wish people ask me, do you give lectures which is going to teach me concepts? There should be some tricks and tactics you have to learn to answer this kind of questions. Please know the key factors for success based on the pattern I've discussed. Hi, all of you. Greetings of the day and welcome to Dental Amaze Academy. So today in this very short session, what I'm going to give you is or make you understand is NEET MDS exam pattern analysis. Now this is very, very, very important because before starting your preparation, you should be knowing exactly what are you learning for. There should be a perfect strategy out there on what are you learning for, because I've seen many students who start blindly. They get some notes, they get their dental pulse, and then they start and they realize very late that this is what was not required and this is what I should have followed, and now you're late. Okay, which should not happen. Okay, I'm especially talking about those people who are doing self-preparation. Okay, now if you're into the academy, you get the guidance right away from day one. Okay, so okay, those who are starting, this one is very, very important for you. So you know that this is your exam question pattern. That is, you've got 240 questions, 180 minutes. So what I'm going to do here is I'm going to divide the questions into different groups based on their difficulty level. Okay, so I'm going to discuss one by one. So you get 100 questions, then 50, then another set 30 to 50, and finally the fourth set 25 to 40. In each set, I'm going to discuss the type or difficulty level of the question. What is the significance of the question, this 100 questions? Okay, where is your rank going to be? And finally, from where are you going to learn these questions? Okay, very, very important. So let's take the most easiest of first 100 set of questions. Now this can be like 80, 90, 100, 110 like that. There should be a small variation, but in general I'm talking about. So if you take this first set of 100 questions, you will find that 100 questions are easy questions. Okay, they're easy questions, simple questions, okay, which are direct repeats, okay, of your previous questions, or very easy modified versions of your previous questions. Okay, so this is the questions we all love to answer, and you get around 100. Okay, I'll tell you maximum how much, but around 100 in general. Okay, so this is the easy questions, direct repeats. You get it from your guides. Okay, I'm going to tell you where. Now, what is significance? Now, don't think that this easy questions, it is not significant enough. It is actually, if you miss a few questions here, unlike any other sets what I'm going to discuss later on, if you miss out a few questions here, okay, you're going to be out of your competition. I'll give you example how. Okay, that is, if you just take one question among this, okay, hypothetically, it's not as complicated as I would say, but just for hypothetical situation, let's take one question. Okay, or let it be 10 questions out of this 100. Okay, and you imagine that 301 students are writing the exam. Okay, just imagine, you know that there are 32,000 students, but hypothetically, imagine there is 301 students writing the exam. We are taking 1 or 10 questions from this list, and you imagine that all the 300 questions, so 300 were others and 1 were you. Okay, so all the 300 students got it correct and you got it wrong, hypothetically, or I got it wrong, let it be me. Okay, then what is your or my rank is going to be? So 300 students got it correct, your rank is going to be 301. Okay, so that is why I'm going to tell you dental pulse or dentist or previous question papers are so important. So important. It's not that it is going to give you the top 250 ranks or top 350 ranks, but it is going to keep you in competition. Hope you understood the maths behind. Hope you got the importance of these questions. You can't miss out many, and these are the easiest of questions to learn. Now, from where do you get these questions? You all know it from your dental pulse or dentist, anyone, not both. Okay, now. And that's why we tell you have to learn dental pulse dentist. It's not that you're going to get everything from there, but yes, this to keep you in competition. These questions are very, very important. So that's the first set of questions. That is the first 100 questions out there, which we understood. Easiest of questions. You can't miss it out. Yes, you get it directly from your dental pulse. Okay. Next 50 questions. Again, the type of questions are moderately difficult. They are not easy, they are not difficult, they are in between that. Okay, moderately difficult. And these are modified, difficult versions of previous repeats. Okay, this area's direct repeats. This is a modified, difficult version of previous repeats, and little bit of thinking is needed here. You can't directly read the question and answer it. If you have previously written the NEET exam, you know that certain questions you read the first line, you know the answer. This is not that kind of questions. A little bit of thinking is needed. Now, what is the significance of this? You can get close to 1000 rank. Now, still you are not there in the top 350. Okay, you are coming closer to 1000. I'm not saying you will be 1100 and all. You can even be 2000, 3000, 4000 like that, depending upon how many negatives you got there. So to get negatives lesser, that's a different lecture. I'll tell you later on. But here, the significance of this 50 questions is that you come very close to the 1000. Depending upon what you're remaining, these areas, how you have done everything. Okay, but yes, the maximum, the best you can do is reach close to 1000 if you have mastered these kind of questions. Now, where do you learn this? It's combining your dental pulse definitely with your theory. Okay, combining your dental pulse with your theory, because the questions will be a dental pulse or dentist or whatever. But what I mean here is your previous repeat questions with your theory, because the questions will be modified versions of that. Okay, so if you know the theory behind, you can answer them. Second area is notes. Okay, your notes, which is given by the academy, can do that. Question solving, lots of questions, practice questions on the app. You get that, fine. Okay, you're getting this 150 now. Not over. We are coming to the most crucial set of questions. Okay, so the next set is 30 to 50 questions, which are known as dark spots. Okay, this is where your rank is going to get decided, if you want to get into a government college or a reputed college or not. Okay, now these questions you can term it as difficult questions. Okay, these are the difficult questions. Now, based on core concepts. Now the concepts are going to get asked here. It's not your direct repeats, it's not the modified versions of direct repeats, it's a core concepts which is going to ask here. The simple example I give you in community dentistry is your test of significance, chi-square test, t-test, ANOVA test. So if you have to answer such questions, you have to be very clear with your concepts. And these areas are there in every subject. Okay, now it will be application level or clinical case based questions or image based questions. Okay, so these questions are very, very, very crucial, and it includes your medical subjects as well. People don't understand the importance of understanding the concepts of medical subjects. They think that they just by heart dental pulse and go, they can answer. It's the most difficult area to answer your medical subjects core concepts, because you have not exposed to it. Okay, now that's about the type of this type of questions. The significance of these questions is it decides your rank between 1 to 350. Now, this is why you people are here, isn't it? You want to get a rank of 1 to 350 anywhere. That is, you have to get your government seat. Okay, so if you're a little wrong in this area, you can get there 500, 600 and all, and get into a good private seat as well. Okay, so this area is also important. Now, you'll ask me from where you're going to learn this. Now, this is where your concepts has to be very, very, very clear. This is where you have to get lectures. Notes will not give you. Okay, this type of questions, you don't get it from notes or by simply solving some random MCQs. Notes can't teach you concepts. Many students ask me, do you give notes? Okay, do you give notes? Or that's the first question people ask. I wish people ask me, do you give lectures which is going to teach me concepts? That is not what people ask. Now see, notes are very, very important, and we do give notes, but what is more important is this area, the lectures, the question discussions, the difficult question discussions, solving new questions and discussing them. This is going to give you the core areas, very, very, very important. Okay, so this is about where you're going to get this type of questions, and this is where the biggest problem happens for most of the students. Now, we are not over yet. We've got the last 25 to 40 questions. Okay, 25 to 40 questions. Now, wait, 25 to 40. Now, this is where people tell me, hey, the exam was very, very difficult. Okay, if you get 40 questions, people will say exam was extremely difficult. 200 questions, Baba, was good ones. But we have the psychology in our mind that, okay, we see around 25 plus or 30 plus questions which were very difficult. The exam was very difficult. So this is what happened. So 25 questions were of this sort, and remaining was the other type. Then people say it was moderately difficult. Okay. Anyway, let's come to the same understanding. What is the type of questions you call it? It is called very difficult questions. Okay. And this is outside your core concepts. Okay, it will be many a times completely new topics. It's the best example I can give you was people once in AIMS exam, okay, or NEET also it can come. AIMS exam, they learned everything about cleft lip and palate, and they went for the exam. They saw that the question asked was Nagpur classification. Okay, Nagpur classification. So in fact, in NEET, you get very little of this type. More kind of this is their names. Okay, so completely new questions, recent advances from questions from journals. You don't need to worry about this too much. Okay, because this will, if you know how to tackle these questions, those questions are not going to affect you. Now, what is the significance? Okay, that is you have to identify this area, isn't it? You have to identify this area. So if you are properly studying for your entire year, you'll be able to identify this area. That this is outside your core concepts. You have to be a little careful here to selectively attempt it. Okay, and that is, don't attempt all, selectively attempt it and reduce your negative markings. Okay, you have to attempt it. I'm not saying it should not be attempted. You have to selectively attempt it in a way which is called a knowledgeable guesswork. There is no role for blind guesswork in NEET exam or INSET exam. There should be some tricks and tactics you have to learn to answer this kind of questions. Okay, again, guidance is very, very, very crucial here. Okay, and I'm going to tell you that where you're going to get the questions, new question solving, guidance. Under guidance, do you need to read some areas of textbook? There should be some selective topic MCQ solving separately. Okay, advanced discussions, live sessions. This is where you get these questions, and you'll be able to eliminate which is absolutely outside, and don't get negative, and selectively attempt the answer by knowledgeable guessworks, tips, tricks, and tactics. Okay, everything needs a much more explanation, I know, but yes, I'm just going to conclude it here. There's also, you have to understand something known as the difference between NEET and INICET. I'll come with other lecture, but please know the key factors for success based on the pattern I've discussed. There should be a proper guidance. You have to learn your basics and concepts properly. In whatever you are learning, you should be learning it very systematically, and you should be learning what is required. Overdoing is the biggest mistake people do for NEET MDS preparation. In proper learning strategy and proper revision strategy. So this needs, I know that this needs explanation. I'll have another session for this, but hopefully you understood what is being said here. I'll just conclude it here and come with these topics in the next session. Thank you so much.